if I just look at 5 years back, maybe 6 years back, heart rate was something that you could listen to, but literally listen about, but not as much HRV, right? HRV has become such an amazing buzzword, but would love to understand for somebody who's worked in the HRV space for so long, what does HRV really mean in simplified terms for people who are new to this, and what could it unlock for the human health?
So in terms of HRV, what we refer to is the variability between heartbeats. So we are all familiar probably with heart rate and how we can measure that both at rest and during exercise. So even when we are resting and we measure our heart rate, the thing is that the variation between beats is not always the same. So even if our heart rate is about 60 beats per minute, it does not mean that there is a beat exactly every second. There is always some variation in there, and that is what we quantify with heart rate variability. So this variability between beats. And why do we care about that? Well, the reason is that this variability is not random. It is modulated by the autonomic nervous system. And the autonomic nervous system is basically influenced by our response to stressors. So as we face a stressor, there will be a change in autonomic nervous activity. We cannot measure directly autonomic nervous activity, but then we can measure how the heart, and in particular heart rhythm, is impacted by these changes in autonomous nervous system activity. So basically, HRV becomes just a proxy of our response to stressors, which means that if we have, for example, reduced variability between beats, so the heart rate gets a little more constant, that means that typically there is higher stress. While if we have increased variability, so there is more beat-to-beat variation, which we capture with HRV measurements, that would mean that there is less stress on the body. So that is why we look into this parameter, and the research, it's been out for maybe 50 years or longer, right? So it's something that has been investigated for long, but the technology has been slower because it is not so easy to capture accurately this beat-to-beat variation. So while we can typically, at least at rest, measure heart rate easily, even with optical methods like optical sensors that we have nowadays in watches and other sensors, or in phone cameras and things like that. HRV is a bit more complicated because it's more prone to artifact and issues with movement and all sort of noise, which makes it a little more challenging, even though in the past few years, I would say a few sensors came out that are able to capture, at least at rest, these measures accurately, and they're also more convenient to wear with respect to just straps that were used before. So now it's a bit easier to capture this data and basically look at how it changes in response to different stressors that we face, from sickness to training to all sorts of things that can impact resting physiology.
Right. So I think the fundamental point that you mentioned, I think you addressed that well, is the fact that the science of HRV or the metric HRV, uh, there are so many variations that are out there. Like in terms of if somebody is at rest versus somebody is moving, the interpretation might not be right. So that is one challenge to solve for. And the other one that you mentioned is, yeah, the other one that I'm curious about is, are there biological variabilities as well? Like, for example, two different human beings. For someone, low HRV means stress, but for the other person, low HRV might not mean stress. And is there a baseline effect as well? Like, my actual HRV could always be low. Yeah.
Yeah, it's a great point. As that's something that we also need to understand when we start looking at HRV, is that it's different from other parameters, meaning that there are really no absolute values or population ranges that we can rely on because it is very individual. So for some people, it might be higher, for some, it might be lower. And this is not even necessarily linked to clear aspects such as physical activity level or fitness or things like that that are tightly coupled with other markers, like even just resting heart rate. Like we know that fit endurance athletes, for example, have a low resting heart rate that is due to training. It does not necessarily mean that their HRV will be higher. So HRV is a bit of a more difficult parameter to contextualize in that way, and that is why the only way to actually use this data in an effective way is for a person to keep track, measure daily with software that will then interpret the data only as relative changes with respect to their own data. In that way, it doesn't matter if my HRV is lower than yours, for example, because if I face a stressor, then it will be suppressed with respect to my normal. And if you face a stressor, then it will be suppressed with respect to your normal. So everything is always, let's say, analyzed with respect to your own baseline and your own data, which takes some days to acquire. Otherwise, we cannot really say anything from a single measurement.